Hi, my name is Helen Shih. I am the medical director of the Proton Therapy Centers at Massachusetts General Hospital. I'm also a clinician specialized in treating brain tumors and ocular tumors, which are services that I direct at MGH as well.
And I'm Anthony Zietman. I'm the Chief of Radiation Oncology at the Massachusetts General Hospital in Boston, USA, and I'm a specialist in GU oncology.
I've been working at MGH for just over 22 years. I arrived in 2001 as a resident in radiation oncology and had the great fortune to stay on staff since then.
Helen is very senior, but I'm even more senior. I've been at Mass General for 37 years, and for the better part of 4 decades have been treating GU cancer and using proton therapy. I arrived in 1986, and at that time the program was already 20 years old. We've been treating patients with proton therapy since the 1960s, but we've been treating them on an experimental cyclotron on the Harvard University main campus in the physics lab. And our challenges were that we had just a fixed beam, we had terrible imaging, so we may have great treatment, but we couldn't see our target, and we were very limited. And then approximately 20 years ago, we put in, together with IBA, our very own patient-dedicated facility that really sort of transformed the care of our patients. There are a number of ways in which proton therapy has changed over the last 2 decades. The first of all, it's just become much more patient-friendly. We now have a patient-dedicated facility. We're not sharing with Harvard University and their students. We have gantries which rotate around the patient, so we're no longer using fixed beams. And we have an extraordinary imaging capacity these days, which allows us to visualize our targets and use this very sharp radiation treatment to best effect. Outcomes are better, both in terms of cancer control and side effects of treatment, and the quality of life is greatly improved in our long-term survivors. When we switched from a fixed beam to a moving gantry, all of a sudden we had much more versatility in our treatment. Previously, we had to rotate the patients within the beam to find and treat the target. And many patients couldn't do this, or it wasn't technically feasible. Now, really any cancer anywhere in the body became amenable to treatment with proton therapy. The one piece of advice that I can give from all my years in proton therapy is to recognize that when one enters a relationship with a vendor that's making a piece of proton equipment, this is a very unique relationship. It's one that involves a big capital expense, and it's one that's going to go on for decades and decades. This is not like buying a linear accelerator, which is a few $1,000,000 and it lasts maybe a decade at the most. No, this is a relationship that will go on longer than most marriages. And for that reason, I think you have to enter into a relationship with a really stable partner. One who's going to be here, one who's innovating, and one who will be with you for the entire length of the machine, and then for the restoration that may well follow.
We're very excited for the restoration of our proton facility, which will be the ProteusPLUS system. And on this, we expect that we'll be able to conduct many more clinical trials, more than we can do now using this latest technology. These will be studies that look to assess whether protons can either cure or control more disease, because we have better imaging system and conformal treatment, and also to reduce side effects by reducing radiation to the unaffected normal tissues.